I started out working on a psychiatric unit using art as diagnosis and treatment for people with emotional disabilities, and just learned the power of art and how people with special needs can really utilize the art. And so I had the courage to break away and create my own nonprofit organization.
What colors are in the ocean? What colors do you think?
So many populations respond to the arts, and so Art Therapy Express, we go into the schools, many different school districts, and students that have trouble verbally expressing themselves are able to, through the arts, say what they want to say.
You want another color?
The students are using any kind of movement that they have. The students have disabilities, but they can use any of their abilities to make art. They can use a lot of different movements with their heads or their feet, using their hands in different ways to make art than a typical student might use. So they definitely get joy out of creating, and I think for a student who doesn't have a way to communicate, that art can be a way that they can express themselves.
1, 2, 3. Woo!
When our kids utilize some of the different adaptive materials, whether it's being in a swing and they're moving their legs, or they're moving their arms and using an adaptive piece of equipment, just those movements are priceless for our kids. So the more we can get the kids to utilize their bodies, in order that, and more we can see that they know the connection between both, that has been a real joy of the program. Art has one way of putting the internal out on paper, and we all get to support and celebrate their successes.
Everybody learns differently, everybody works differently, and in the end, everybody can do it. And you just watch them work, the kids work together, and it's just really, it's very special. They are different people for having done this and for having this friendship. I really think they've changed. And I feel like we've changed too, just by having the opportunity. And just acceptance and appreciation of all people.
What's your favorite brush to use? The big brush, the little brush, or the sponge? You want to use the sponge?
Nothing like this exists that I know of in even the tri-state area. The schools wanted it, the parents wanted it, and we just answered a need. And I think what you see here is the joy that happens when you bring together students with and without disabilities. And that's really the turn of the program, is how much people with disabilities can teach us. It's more than just art, it's about life and quality of life.
The history of Westside Health is very, very community-based. It was started in the mid-'80s. Our organization is very focused on our mission, which is a simple one, to provide equal access to quality health care. We do that by reducing barriers to care for underserved populations. So the barriers we address are things like uninsurance. People need affordable health care. They need access. So transportation is often an issue. Language is a huge barrier, especially in our early days when we were focusing on the Hispanic communities.
Yeah, eso parece como poison ivy que está mejorando. Okay, so at any time if you feel like your throat is...
There's also health literacy issues, education. People don't understand the importance of a medical home. So all of those barriers we attack and address, and if we can eliminate them, then people will come in and get the health care that they need. Our primary care focus is that we want to be the medical home, and our model is family medicine. From preconception to elder care, all members of the family can participate with the same medical team, and we feel that that's the most effective way to serve families and communities. And we've been doing that and stayed true to that philosophy for all of the years of our existence.
This is really that idea of it takes a community. I mean, it takes the whole staff really to deliver excellent health care, and we've got a fantastic staff. Everything from the MAs to the receptionists to, you know, financial aid. It's a great team. The folks really take pride in their work. They really love working with the patients, and so it's really a privilege working with the folks that I work with.
This is a critical institution for our community and for the patients who I take care of. The entire family can be cared for at Westside Health with our family practice specialists and the pediatricians, and there are other services available such as dental care, which can be very expensive as well. So it's a holistic approach which follows the individual actually from before they're even conceived right through to when they're retired.
By having a medical home, then people will have a place to go. We want to keep people out of the emergency room unless they need to be there. We want to reduce readmissions for the hospital, and people just to feel confident that if they aren't feeling well, they have a place to call and they'll be able to be seen in a prompt manner. We want to be your medical home, and we really want to treat you well.
To have Kim Costas here with us today from the Food Bank of Delaware. Hi, Kim.
Hi, thank you for having me.
Certainly. And the work that you're doing is so important, especially now in this economic crisis. It's really one of the survival focuses.
Food is a basic need for everybody, so with the economy, there's been tons of people that have been impacted through job losses, or their dollars just aren't going as far as they used to. So we released some new statistics early in 2010 on the number of Delawareans that are in need of food assistance. Back in 2006, we were serving a little under 90,000. Now we're serving close to 242,000. So it's nearly 1 in 4 Delawareans we touch at one point or another during the year. People that once donated their money, their food, their time are now needing help themselves. So we've really had to focus our efforts, and we've had to expand our program offerings. We have a culinary school where we train under and unemployed adults cooking skills so that they can get jobs so they can sustain on their own. We're really focusing on our efforts to feed children in Delaware during the summer, after school, and weekends. So we're really looking at new ways to feed people versus the traditional bringing in canned goods and other donated products and then warehousing them and then getting them out. Oftentimes, when we think of people that are hungry, we think of homeless people, or sometimes people think, oh, they are lazy, they don't want to get a job. But we actually had an individual that came to the food bank in need of assistance. He was a self-contractor with Chrysler. We all know that Chrysler doors shut. The building is pretty much demolished by now. And he lost his contract. His wife, who has a master's degree, lost her job. And for the first time ever, they needed to reach out for assistance. And they had never needed help before, so they really didn't know where to go. So I think that's just an example of the new face of hunger in the state.
So tell me how the public can engage with you.
We're driven by volunteers at the food bank. We can't do what we do without them, and it's one of the reasons why we're expanding our branch in Milford. We are always looking for people to host food drives for us. Typically around the holidays, everybody wants to get involved with food drives, but as January, February, March rolls around, our donations decrease significantly. So now is a great time to host food drives at your church or business, schools, and other community-based organizations.
Thank you, Kim.
Thank you.
We're talking with Rashmi Rangan, Executive Director of the Delaware Community Reinvestment Action Council. Rashmi, what's DCRAC?
Delaware Community Reinvestment Action Council, or DCRAC as we fondly call ourselves, is a nonprofit organization in the state of Delaware that was founded to ensure that Delawareans would have equitable treatment and equal access to credit and capital. So our focus has been consumer finance in Delaware.
Well, the creation of an organization like that seems to suggest that everybody's not getting equal access, or there wouldn't be that organization.
That is indeed the case, and it was the case in 1987 when we were founded. Jim Sills was the chairperson. There was a study done by University of Delaware students that found effectively that there was some redlining in Delaware. So mortgage was not equitably accessible to everyone. And our success, or the real impact that our organization made in its very infancy, was to get Delawareans equitable access to mortgage finance. And then there's so much more work that still needs to be done.
Such as what? I mean, if they now have access, what more can you do?
Well, economy changed over the last 24 years. So while there was equal access regardless of your race to mortgages, we were also seeing that there was a disparate lending going on. So there were protected classes that were receiving those toxic mortgages. They were adjustable rate loans. They were interest only with a balloon payment in 40 years. So it became unequal again. And much of that was we kept our eye on advocacy and on the financial institutions, and we raised the concerns as we saw them to the appropriate regulators. But in this mortgage crisis, and I focus on mortgage crisis, in the mortgage crisis, really everyone was asleep. We all know that the homeowner did not act alone, right? The homeowner applied for a mortgage, but there were so many other industries that were complicit in causing a crisis. Now it is a crisis of confidence. So today we need to rebuild confidence amongst Delawareans, amongst Delaware's financial institutions, and amongst the regulators.
Everybody says the banks have plenty of money, but they're not lending it now.
That is true.
Not just to protected classes, but not to anybody.
That's true. And it is all because we have no confidence in our future. We do not know what tomorrow will bring. And when you have that kind of uncertainty, then you certainly do not want to take on debt. So jobs become a major issue.
Yeah, how far can this kind of citizen activism push till you get policy changes, till things actually become different?
Well, obviously, citizens need to constantly be vigilant and continue citizens' activism. The Occupy movement is all about pushing the boundaries, demanding equity relative to all these toxic products that really are sold to the poor people who can't possibly pay the 900% APR interest rate. Our activism led to the creation of consumer financial protection bureaus. And true, who would not want these kind of toxic players to be regulated or watched over? Apparently, there are some people who don't care for regulation of these players. Otherwise, we would have a director nominated, confirmed, because as soon as we have the Consumer Financial Protection Bureau director, all of these fringe financial products get some form of regulation. At the moment, particularly in Delaware, there is no law that is broken if you've gotten a 900% APR loan. So for a consumer, there is no relief. Or whom do they call and say, can you do something? So we need the Consumer Financial Protection Bureau. Our work is never over our activism will continue. We need policy changes. Policy needs to recognize that sound practices require oversight of moral hazard, because that's what caused us to be in the crisis that we are in at every level. So our work is never over.